Another dentate patient who has got very poor quality bone, particularly in the front, in the upper. But the bigger problem here is that the roots of his teeth are almost touching the nasal floor. So there's not a great deal of bone between the root apex and the nasal floor, which means that we don't have a lot of bone to work with. So we're going to need to plan something, again, more than 4 in this case. We'll need to put additional implants to have some additional support. So the plan for him was to have 5 implants on the top, but that would also depend on the zygoma bone. If we have good zygoma bone, then that's great, because we need to put zygomatic implants to overcome the poor bone in quadrant 1 and also the sinuses in quadrant 2. But if you look at the bone situation of the zygoma in quadrant 1, on the right side, the zygoma bone is nice and thick, so there is a good bone to anchor a zygoma implant into. But on the left side, you can see it's extremely thin. So this is there's a lot less anchorage of that zygoma implant within this bone. So we need to think to do something additional in this area in order to provide better support, which is more predictable. So we decided to add a pterygoid implant, and that was part of his plan from the start. And here is the patient. You can see what I was talking about when I say the restorative space was quite compromised. We had to open him up almost 10 millimeters. So that is quite a lot of opening of the vertical dimension. And before we start, we build it up with some composite so that we establish the vertical dimension based on his speech. So after you build up the composite, the patient talks and you can see if there's any interference. And once we establish that vertical, we then take a digital scan so we can correlate that and we can start making the smile design. So the final result for this patient was exactly how I planned it. It was a zygoma on each side, 3 implants in the front, and then a pterygoid implant to support the one on the left side, the zygoma on the left side, because that zygoma was anchored into a very narrow cheekbone. Now, if you look on the lower, so the lower has got 4 implants, and that's enough to support the full set because the bone was better. But you can also see that the cantilevers are quite long. And the reason they're long is because of the position of where the dental nerve is. So the inferior dental nerve here and the loop from the mental foramen was quite far forward, which meant that I couldn't position the implants more spread apart. But I still wanted to give the patient a full set of teeth. So by using a wider implant, a 5.5 by 16 on each side, and especially when you get good stability, I'm very comfortable extending this bridge and giving a longer cantilever, especially if I have enough restorative space and if the implant size is adequate. So a 5.5 by 16 is what I consider to be adequate.